am Casey Spain. I am the Marketing and Communications Senior Manager for American Pets Alive and the Human Animal Support Services Project. Thank you all so much for being here today. We have so many people jumping in, and we have some incredible panelists, speakers for you today. We're really excited about this talk. It's going to be really powerful. This talk is called How to Expand Veterinary Access, Increase Revenues, and prevent, oh, I lost my notes
burnout.
Here. Prevent burnout, very important. Prevent burnout, obviously. I must be burned out. I can't even remember the names of webinars anymore. So thank you all so much for being here. As you all join, our wonderful participants that have joined this webinar, go ahead and throw in the chat where you're from so that we can see where we've got all of our incredible guests from. Wow. Illinois, Maryland, San Diego, all across the country, coast to coast, Denver, Santa Barbara. Very cool. This is so great. We're so glad to have all of you. Thank you all for being here. All right, so as we get started, we're also live on Facebook. Hello, Facebook family. We're thrilled to be here. We hope that you will ask us some questions on Facebook and on this event. And so we'll get to that section, just a little bit of housekeeping. If you will ask questions in the Q&A feature, that way we can make sure that we can answer them in the order that they come in. We will have a 20-minute presentation, about 20 minutes of discussion, and then we will have time for questions. So if something comes up, feel free to just throw it in that Q&A section of Zoom. All right. So I want to thank and introduce all of our incredible panelists here that we have today. Your host tonight will be Dr. Sara Pizano. She is the founder of Team Shelter USA and the author of the Best Practice Playbook for Animal Shelters. She's also a national trainer for Open Door. And then we have Mandy Combs, who is the Veterinary Practice Manager at the Humane Society of Greater Dayton Veterinary Services. Thanks for being here. We have Dr. Stephanye Quinn, and she is the staff veterinarian at the Community Pet Care Clinic in Toledo, Ohio. And we also have Veterinary Collective, and we also have Lisa Labrecque, who is the Director of Veterinary Services of the Humane Society of Sonoma County. I hope I got all of that right. Incredible people, huge resumes. We're so excited that you're here. Thank you for doing this. And big thank you to Maddie's Fund as well for helping to sponsor this webinar and so much of the great work that Open Door is doing as well. So Dr. P, I will turn it over to you.
Great. Thank you so much and welcome everyone. I am going to share my screen and now you can see my messy desktop. And there we go. Awesome. Okay. All right. So we're going to talk about the Open Door model, and just so that you understand the verbiage, Open Door is the model and the Open Door Veterinary Collective is the nonprofit national training program. And this is a webinar that's going to give you kind of a summary snapshot. I'm going to do this 20-minute presentation, then we'll ask the panelists questions, and then we'll open it up for you for questions like Casey said. But this is a blog that recently came out on Haas, and we're going to put the link in the chat there. I also want to say thanks to Maddie's, because Team Shelter and Open Door are part of Maddie's Million Pet Challenge, along with the University of California and the University of Florida. So that link will be in the chat too. That's Maddie's millionpetchallenge.org. And hashtag thanks to Maddie's always. So we can't thank Maddie's enough, I don't think. So there's a couple of overarching premises that we want you to know about this model and about this movement that we are immersed in. And that is, one is we believe that pets and people should have access to veterinary care, and that we as veterinarians and medical teams and staff at our clinics should also be compensated fairly for their work. A lot of times in the nonprofit sector, we're not paid as much as corporate. So we believe that we should make a good salary as animal welfare advocates and Open Door employees as well. But first, let's talk a little bit about this crisis with access to care. And honestly, up until I read some of these studies in the last year or two, I really felt like access to care was an issue for those socioeconomically disadvantaged pet owners. But in fact, it's a much bigger problem, you guys. This is 1 out of 4 households has experienced an access to care issue in the last two years, and that was a 2018 study. So that was before the pandemic. So we can only imagine that these issues are even worse now. We know there's veterinary deserts, there's credit inequity that we're going to talk about. Maybe people have issues with transportation, and then of course, clinics are overwhelmed, we have staffing issues and burnout, and a lot of people leaving the field. So if you haven't read the Access to Veterinary Care report, it is a good read. It will open your eyes to a lot of these issues that go far beyond people living in poverty. So we know that people that have been part of these studies say that lack of access for their pets really causes them mental and emotional stress. And that, of course, makes sense to all of us. We have lots of research now that shows all of these different facets that affect why access to care is a challenge. This study on the screen there is from Meals on Wheels. And so they, several years ago, realized that their clients were feeding the food that was delivered for them to their pets, and then they were going without food. And so that's how Animeals was started, so that now Meals on Wheels does include the pets in the family. This was another shocking thing for me, that even 20% of high income earners are financially fragile. And that is defined as, I can't come up with a $2,000 payment or pay off $2,000 within 30 days if my pet had an emergency. And that goes for almost 30% of middle income owners. There are many millions of people who either are credit invisible or can't or get declined for credit. And 60% of Americans, again, shocking numbers, were in that situation just a couple of years ago. And so you don't have to take the time to read this, but this is sort of the visual. The busyness of this slide is how this all makes us feel. When a parent goes to the veterinarian and they can't pay for services, but their pet is suffering, or their pet needs something, and they leave without those services, they're going to be upset. They're probably going to make the clinic staff and the veterinarian upset. They may go and post something negative online. Everybody suffers through this vicious cycle. So this idea of the open door model started about 5 years ago, and there were 4 founders, one of whom was a veterinarian, 3 non-veterinarians, and they said, you know what, we know that veterinary practices keep complaining about nonprofits having an unfair advantage. So we are going to set out to create a model for profit veterinary clinic that does not compete in terms of having nonprofit funding. And so they opened the Community Pet Care Clinic, and you're going to hear from Dr. Quinn in a little bit, who is the veterinarian there. That is in Toledo, Ohio. And the second hospital was opened in Asheville, North Carolina. and both of them are net profiting just like a regular private practice. And that means, and the benchmark is for a 3-vet practice, net profiting somewhere between 17 and 20%. We also believe that we have potential to increase that net profit even higher. So the training organization, Open Door Veterinary Collective, already has clients. One of the first clients was spending $500,000. This was a nonprofit clinic, raising and spending $500,000 a year. And after the consult, within a year, they were net profiting 30%, which is amazing, right? Such great news. And another clinic was spending the same amount, and in the very first quarter, they net profited $16,000. So I'm sure all of you were thinking, how the heck did they do that? So I'm going to go through each of these kind of pillars of the model, but just a reminder, this can be for the model can be used in a nonprofit clinic. It can be used in a for-profit. It could be used in a community clinic that is operated by a municipality. We also have some unique programs starting up. We have a mobile unit. We have others that are doing programmatic parts of the open door model. So it's super exciting. The training right now is online. Eventually we will be going in person, but because of COVID, we were stationed online for now. But these are the major things that I'm going to talk to you about. So the payment support options. And to me, this is one of the biggest, most major differences with private practice, a general traditional private practice, and nonprofits, because nonprofits have a very bad habit. We just have gotten into this rut of thinking that we have to pay for everybody for everything with respect to their pets. And a lot of people can pay, they just can't pay up front. And so one of the biggest helps is a payment plan. And traditional veterinarians typically don't have payment plans because it's been too cumbersome and they've been low repayment rates. Well, vet billing is actually a company started by a veterinary client who couldn't pay her bills. And we're going to put the website in the chat for your information, vetbilling.com. But a simple payment plan. I can't pay right up front. And I often think, how many of us could buy a house for cash? No, we get a mortgage. So it's the same type of thing when our veterinary cost of services is going up so much higher and exponentially faster than inflation, it becomes very difficult to do the fee for service. Another great thing that happens at our clinics is the state together fund. So $1 from each exam goes into this fund and the veterinarian gets discretionary funding. So what happens is that we normalize the financial conversation. And I'd also like, when we ask the questions, Dr. Quinn to talk about this as well, because there's a lot of shame around the fact that people don't have the money to pay for something that their pet needs. They feel very sad and bad about that. So we want to make sure that we support them and tell them it's okay. We're here to help and let's figure it out together. But normalizing that conversation, don't be afraid to ask people, like, can you do a payment plan? Or what is your max today? And let's figure out what kind of care we can provide. So I want you to think about the big circle is the payment. So the clinic will get paid. It just might not be 100% from the client. It might be. A lot of clients pay everything up front. But if they are unable to do that, one of the circles might be a payment plan. One might be a voucher from a nonprofit partner. One might be from the Stay Together Fund. So those are very, very important partnership opportunities with our clients. Another amazing thing has to do with dentals. We see so many pets with horrible teeth for two reasons. One, people didn't know. They didn't know that their pets had horrible dental disease. Two is they didn't have the money to do a dental cleaning, and now the pet is suffering and there's really serious periodontal disease. So the dental plans can go either way. You can start saving proactively through vet billing or through a dental savings plan, or you could do the vet billing on the flip side and pay the dental off that way. But that's a really great way. Dentals are expensive no matter how you cut it, even though we try to keep our prices in line more with a nonprofit hospital than a traditional hospital. The next thing is incremental care, and vets have been doing this since the beginning of time, but we have to think about, do I need to do all these diagnostics? Will the results change what I do? Is there something symptomatically I can do for the pet and treat them in a way that relieves suffering? And then I can recheck them and see if they got better, or then we go like step by step if we need to do diagnostics. So incremental care is important. We help clients with lots of different decisions like that. And it might also be about the cost of medication. So we link them to websites where they can get discounts on drugs and prescriptions and things like that. And then as far as the business is concerned, the AVMA says that a regular private practice lets $60,000 a year just out the door, whether that's mischarges or not charging or undercharging or something like that. And so really making sure the practice manager is on top of all the expenditures and all the revenue is super important. And then, of course, efficiencies, utilizing our technicians and staff in the most productive way is really important. Sometimes I know I'm guilty of this. I'm like, oh, I could just do it quicker, or I could do it myself. And we always want to try to delegate and train up our techs and our lay staff to do things so that the veterinarian's time can be used more efficiently during those appointments, or maybe for spay neuter or other surgeries. And then of course, optimizing technology. We have in Asheville periodically tried doing the telemedicine during COVID. So when the people were in the car, we had the iPads, in a sort of MacGyvered up so that they could watch their pet in the room. But thinking about all these ways that we can make our practice more efficient and cost effective. So one thing is limiting inventory, keeping inventory of drugs in the practice that we need, for example, pain medications or antibiotics or things like that, but not in huge quantities, because the goal is to script them out or use an online pharmacy that would be cheaper than us purchasing them, and it would give us a bigger profit margin. The next part has to do with those financial options and just integrating social services into this model. And when we talk about the nonprofit sector, the reason this model to me is so valuable and desperately needed is because if a nonprofit can pay a little bit towards a pet's care instead of all of it, they can help more pets. So some of these partnerships might be with nonprofits whereby there is a voucher for a sick animal. In Asheville, we were part of Align Care, which ended for now, but Align Care is just a service, a social services program linking people in need with a veterinary partner. And that will depend on funding moving forward. But ultimately, right now, our clients are nonprofit clinics, but ultimately we are really wanting, and I feel this model has to be the future of veterinary medicine, because there is no other way to make sure that we can provide and enhance access to care. So that One Health idea of treating the whole family, of getting more private practices involved with this model, and all of those things really make a difference to the bottom line. And it really benefits everybody, right? It certainly benefits the pets, the clinics, It reduces owner surrenders, right? And for us as a veterinarian or those of us working in a clinic, there's nothing like saying, don't worry, we're going to help you get through this. And I know I've seen clients at our Asheville clinic that there's no, if they walked out the door without treatment, I wouldn't have slept for days, and I don't know what I would have done. So this is important for the staff and the clients and the pets. So in Toledo, we're so lucky to have a graduate student in social work rotate through the clinic. And this is a person who is helping not just the clients, but also the staff, because it's hard working in a clinic and working in animal welfare. So really happy about that. So I'm going to stop my share, and I'm going to have Lisa start on the questions. And I want to welcome again Dr. Stephanye Quinn from the Community Pet Care Clinic in beautiful Toledo, Ohio, and Mandy Combs from the Humane Society of Dayton in Ohio. So thank you so much. And there we go.
Well, Dr. Pizano, I'm going to start with you. I have a few questions I'm going to send your way. The first one is how you think the open door model fits in with the current structure of private practice.
Yeah, that's a really good question. And I think that in private practice, the industry just developed as a regular business. But as costs have exponentially risen higher than inflation, I truly feel this has to be the future of veterinary medicine. I really do. I don't see another way. And the cool thing is, it doesn't take some dramatic, change. It just takes some of the staff being trained and kind of a different philosophy around how we interact and help clients. Dr. Quinn, do you want to add something to that?
Yeah, I completely agree. I think that moving into an area where we can help more clients and help more pets and just change the face of veterinary medicine in a way where we've kind of always been this old school kind of approach, and our clients are changing. The way that they view their pets is changing, and we as a profession need to change as well.
Yeah, it's interesting. For those of us that have worked in private practice in the past, I think we've tinkered around with some of these ideas, a little bit of this, a little bit of that, to try to figure out what works. And it's really neat how you brought together this formula of all of these parts that work together to make a difference. What are some of the ways you're helping non-traditional practices?
Well, some of our clients now, and these things are just emerging, we have a mobile practice. We also have practices who are doing programmatic things, like maybe they don't have a brick and mortar shelter, but they're doing community pet services. So that's been really interesting, because when we started out, and mind you, I'm not a founder, I'm just the spokesperson, but when we started out, it was like going to be brick and mortar, but it's just been great to have these other opportunities. And those have been pretty unique. And I think there's more of that to come as people get so incredibly creative when there's so much need.
Yep. I'm going to go right to a question that I know a lot of us are really or a topic where a lot of us are really struggling with in our profession. And that is the shortage of veterinarians and veterinary staff. And I'm curious, with these shortages and clinics stretched so thin, what are some of the challenges in implementing your model that you can talk about?
Yeah, and we're going to put a webinar in the chat that our founder, Amy St. Arnaud, did about the veterinary shortage. So it definitely I don't think it's going to get any better for sure. But I will say I'm a little disappointed that I'm not seeing the conversation about. In 1985 or so, the number of females and males going to vet school was 50-50%. And today, 90% of women are graduating out of 90% of the women graduating women make up 90% of the class, right? So that means you have female veterinarians coming out of vet school at 26 years old, which is their prime baby making years, and they're going to get married and have babies. And I feel like the industry hasn't supported them. And so many veterinarians that are having kids are leaving because, you have to work full time, or you have to work 10 hours, or you didn't stay overtime. Sorry. It's a new day, fellas. Like, we have to, I don't know what the word is, cater, like we have to create these support systems so that women, especially in their 30s and 40s, that are making up the workforce have it easy instead of harder. And it's been harder, so they're leaving the field. I'm a little opinionated about that. So Mandy, I have a question for you. Tell us, because you've been in private practice and and now with the Humane Society of Dayton at the clinic. So what differences are you seeing with your Open Door clinic versus your private practice clinics?
Well, I started as a receptionist in the early 90s. So in a very small town practice. And actually, I feel like some of the things that we were doing in that time, I see coming around again. We were talking to the owners. We were determining our course of action by really understanding what the owners were capable of and what they could do in our little small town and what their financial abilities were. And we were having open conversations. And then as we went through the years, I started to see more and more changes where, that it was absolutely necessary to plan everyone. And if they couldn't comply, we couldn't help them, and that, and I think that really creates a negative culture where you can't be successful. You can't, veterinarians want to treat their patients and they don't want to turn their patients away. And so now you have an uncomfortable culture where you're not winning, you're not succeeding. And then now when I see Open Door and we're normalizing spectrum of care and we're normalizing access to care and we're managing expectations and meeting people where they are, I feel like I got to turn back the clock a little bit and, in my little tiny hometown practice that I started in. So yeah, I think it's a great direction for private practices to be able to go in a supported, organized way.
I totally agree. And Dr. Quinn, so you're a veterinarian. So tell us why you chose the Toledo clinic, why you chose the Open Door clinic.
Yeah, absolutely. So I've always had a passion for working with people in low income areas. I think it stems from my time in St. Kitts when I was studying, going to vet school. Animals are not viewed the same way in St. Kitts. And so our vet school students have a real major impact on the community by going out and educating and kind of just getting our feet on the ground. We have to prioritize treatments for our patients based on not only financial constraints, but also viewpoints on what this animal's job is, which is kind of different than the way that we look at animals in the United States right now, especially with the millennial generation having pets rather than children. So it kind of set me up for this type of care, and I love it. It's a puzzle that I love to put together. It really lets me be hands-on with my patients, with my pet parents, to really work with them, get to know them on a little bit of a deeper level. Because if I know that, you know, so-and-so's pet parent is going to be having a baby next month, I'm going to talk to them about that. Like, is this in your financial plan today to do all of this diagnostic testing, or can we do more of an incremental approach for you? So when I was looking to make a career change, I gravitated to community pet care because of their mission to alleviate barriers to veterinary care, offering the financial options to pet parents, thus allowing me to provide the quality medicine that I want to be able to provide to any animal that walks through the door, but also without the stress of those budget constraints as well.
Amen. What a great answer. Yes. Lisa, you got another one?
I do. I'm curious how many clients Open Door Veterinary Collective has currently. How many clinics are you working with?
So right now, besides the clinic in Toledo and Asheville, so we have 20 active clients and we have 20 applications pending, and we're a small team. So it's really exciting. Like, that's giant for us, especially since the nonprofit Open Door Veterinary Collective was started in 2021.
Wow.
So yeah,
Impressive.
so we're really excited. And then the Maddies, we're part of the Maddies Million Pet Challenge, and that started in January 2022. And so we this year are giving 8 pro bono clinic assessments, and we have enough clinics to last us the whole 5 years of the grant. So it's, I think it's really resonating with people. So we're so excited about that. Yes.
Awesome. Can I respond to one of the questions in the Q&A?
Sure.
From Ellen, asking about a community clinic that she runs as part of an animal care sanctuary. And she's asking for how we would recommend partnering with private practice veterinarians. And that's probably an entire separate webinar, but I did just want to point her to a resource that I think Eliza's going to put a link into the chat, and that is Haas's external facing medical care working group and a series of toolkits that we put together over the past year or so. And one of them in particular, Ellen, I think will give you some information that you need. So quickly, what the 3 are: there's an in-shelter support care program. There's another one based on using existing veterinary practices to provide medical care. And then the third toolkit is starting a facility from scratch. So don't want to take away from the topic at hand, but I just saw the question and wanted to provide a quick point toward those resources that are available on the Haas website.
Thanks, Lisa. And also for that question, send the vets the Haas blog that we just did, because it's really a great snapshot about the Open Door model. So that's a good resource as well. And when you're trying to partner with private practices, you have to remember that they have to make up a bottom line. So this is the perfect way to do that, and always keep that in mind. We also know that when veterinarians discount, say they say, oh, we'll give a 10% discount, versus you look at the payment plans, and the repayment rates with vet billing can be as high as 97%. So that means like you're only risking 3% as opposed to 10%, right? So it makes sense financially. But Dr. Quinn will agree with me. We don't get a lot of finance education in vet school, do we, Dr. Quinn? So we're not always the best in finance, but thank goodness for Open Door. Yeah. So I have a question for Mandy. So I know that you just, recently started the model. Do you anticipate or forecast that you'll be able to continue to increase your net profit moving forward? Or do you see lots of opportunities for that?
Yeah, absolutely. We've only been, we're 7 weeks in right now, so it's really new. We have one FTE doctor and a small team. So right now we're still like growing pains city over here,
Yeah.
but already I'm seeing week after week of increase. A lot of it due to the fact that we're able to offer these payment plans, which has, really satisfied a need for our clients.
Yes.
And then also, there's a lot of help from Open Door in proper scheduling, proper pricing. And those are things that I'd worked on in the past in private practice and owning my own practice, but having these documents of support, just libraries of really clear documentation of, this scheduling method is going to help increase your productivity. And these prices are going to help increase your productivity. I think that support, especially from a management perspective, when a lot of time you really feel all alone,
Yes,
is
that's
really,
great. Yes.
really helpful.
Awesome. I'm so glad to hear that. And I just want to mention too, so with Mandy's model of one doctor, you're looking to net profit around 5 or 7%. So when I said 17 to 20, that's with a 3 doctor, but you'll still net profit with one doctor. So that's really exciting. We're so happy to have you. Dr. Quinn, can you talk about veterinarians that you meet in the community and what their perception is or what their opinion is about Open Door? Are you getting good feedback, negative feedback? Tell us about that.
Yeah, so I believe that we are seeing a lot of positive feedback in the community. I actually did some filling in at our local emergency hospital back before we became a one doctor practice. And they were always referring to us when there was an animal that came into the emergency clinic with any sort of financial constraints. They would do their best to work with them to the best of their abilities to get them stabilized. And then they would reach out to us to transfer them in the morning or provide our information to send them over in the morning. I also find that we get a lot of referrals from other private practices that maybe can't always offer procedures as cost effectively as we can. Most commonly dentals. We get a lot of referred dentals, a lot of referred spay neuter, despite us having a high volume spay neuter clinic in the area. We do still also get a lot of referrals for that as well. So overall, I think the community perception of our clinic is very high. I think even if veterinarians didn't approve of our model, the fact that they are still sending their clients to us shows faith that they do. They approve of our model, they approve of the medicine that we're providing their clients, because I wouldn't send my clients somewhere that I wasn't going to be happy with the service that they would receive.
Congratulations, Dr. Quinn. That's an amazing, amazing statement. We're really proud of you for that. And I think that it benefits them, right? They have a place to refer to. And also then they're like, what is this Open Door thing? Like, how can I get involved, right?
Yeah, absolutely. And I think that it also provides them a safe space, also helps with the other veterinarians as far as their compassion fatigue too, because, the more animals that you can't help, the harder that is on the system. And so knowing that you can refer them somewhere that that they'll get the proper care and the financial support they need, I think alleviates a lot of stress on the veterinarians as well.
Yes, definitely. I have a question for Mandy, actually. So with your one veterinarian, you have one full-time veterinarian, are they doing just clinic Monday through Friday all day?
We're doing 4 10-hour days.
Okay.
So Monday through Thursday with the staff, 10-hour days. 2 of those days we're doing Tuesdays and Thursdays, we're doing surgery in the morning. And Mondays and Wednesdays, we're seeing appointments all day.
Okay, got it. Because I'm sure there's some people on the on the meeting who are thinking like our vet does some community and some shelter and we're trying to juggle everything. So I was just wondering
Yeah, we're
how you
all
were set
in
up.
the
Got
the
it.
clinic. Our spay neuter, high volume spay neuter clinic on the other side handles the shelter med here. So our vet is just 100% public.
Okay,
Public facing.
awesome. Awesome. So Lisa, I think we're ready to open it up for audience questions. Do,
Great.
do, 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 do. So what questions do we have?
Okay. One from Suzanne. Did y'all talk about this at all? She says, one thing I worry about and think many clinics might also, so many clinics are feeling overwhelmed with workload now and struggling with being short-staffed. This model allows for you to help more clients, but how are you all managing the workload?
Actually, let me just make a comment about that. So we totally appreciate that question and what everybody's going through, but I think there's two sides of this. So it's not necessarily about a veterinarian seeing many more cases. It's about your existing clients being able to provide for their client, for their pets right now. And so until you're right, until a clinic can, expand, they probably won't be able to see more clients. But again, when you look at these efficiencies and the scheduling, I can tell you when I'm in private practice, and Mandy and Dr. Quinn, I think you probably will agree, holy cow, I bet you there's 30% no-shows, maybe 40%, even though we did all the reminders and the texts and all that, right? So no-shows are an issue. So it's not necessarily asking vets or any staff to do more. We're just saying, let's work smarter, not harder.
It sounds like it's shifting the focus from making money to taking better care of our patients and our clients, which is what most of us went to vet
100%.
school to do.
100%. 100%. Yes.
And I would also add in that it also is really important to have your technical staff really comfortable as well, to help decrease burnout when they have a set schedule of what they are responsible for, and have the backup from the rest of the team that's properly trained. It does really help to decrease the number of inefficiencies to really
Right.
decrease that burnout too. So having a properly trained staff and everybody having their proper duties also helps with that as well.
Absolutely. And just to tag on to that is one of the things, Lisa, that we always encourage is when the client is making the appointment is to figure out if there might be some sort of financial barrier. So, hey, do you need to find out about our financial support options, as opposed to they went through reception, the tech, the end of the vet recommends everything. The client's like, that sounds great. And then they can't afford it. Now we have to start, right? Explaining all the financial support options. So doing those things ahead of time. And again, that's taking the shame out of those financial conversations and making sure like we're not making anybody feel bad. That's really important too. But like Dr. Quinn said, the efficiency that then everybody knows what to expect, clients and staff, and it makes for a better, easier flow of your day.
That's great. Thank you so much. Yeah. And thinking about that, I think a lot about the Haas model and so much of what you're talking about has to do with a lot of the things that we're working on with Haas and really reimagining the way that we have done things for years and years. Right. And this is another innovative approach. So as you think about that, there's a question in here that addresses, veterinary clinics being owned by large corporations, and that they believe in the gold standard of care. And so a lot of them are booked out for months, and there's lots of problems with the system, right? If you think about very similarly that there's lots of problems with the system of animal sheltering. And so how do you think, and thinking way outside the box here, you know, I know that there's a lot of talk about shelters, about veterinary practices not having that intermediate type of care role. And then there are many people that are kind of working on that project and talking about what it looks like to have PAs, physician's assistant type roles. And what are some of the innovative things that you see and that you may be working on with Open Door, that you could see really changing the game for the way that we look at veterinary medicine?
Yeah, I think definitely the One Health approach, right? And so looking at how we can marry social services like Animeals with Meals on Wheels, like how can we integrate all these things? Because corporate veterinary medicine is, you know, it's frightening for a lot of practice owners and just for our industry in general. We are also trying to work with corporate as well to see if we can, you know, create systems like this for those hospitals. But I think, again, just looking at any unique ways like the mobile program, like you can do an open door model hybrid, right? Like it doesn't have to be like, this is what we have, this is what you do, and you can't do it any other way. Because a lot of times, as everybody knows on this call, and this has happened to me doing consults, is the shelter will say, thanks for the recommendation, we did it a little bit differently and it worked. And I was like, that's a great idea, why didn't I think of that, right? So I think we are very flexible. We also are a part of research projects so that we take the stigma out of these things and we normalize the payment plan, and we are working with transportation entities to get over that challenge of transportation. So while I hear what everyone is saying about corporate and they're booked out for months, there are tens of millions, just 29 million people alone in the United States are on government assistance and pet owners. So those people are not going to a corporate. So we have so much to do. And the reason we want to be infiltrated into private veterinary practices is because there's about 30,000 private practices and only about 2,000 nonprofits, right? So this is a great start, but we really need to make this a normal part of the industry.
Anybody else have any thoughts on that?
Any other questions?
Yeah, so we have another question here. Sarah Price says, I'm interested in creating payment options for our community members accessing veterinary care, financially fragile. How compatible have you found these models to be with grant style funding?
Well, I think the idea of the open door model, like remember that circle I showed in the middle, like we want to try not to have, oh, the obligatory cat came on, thank you, because we didn't have any animals photo bombing. Look at that cutie. We want to spread the wealth. So grant money can be used as pieces of this as well. We just don't want to see again, nonprofits paying for everything for everybody. Like give people the opportunity to chip in, see what they can pay to extend your grant money. I think that's really important.
And if I can add to that, because we are a nonprofit organization, and so we do have some grant funding that we use to kind of just support the model. We don't count on it. We just use it. For example, you know, we had a donation for cases of urgent care. So we kind of have spread that out a little amongst clients. We don't use it to pay for their whole bill. We use it to help them get started with a down payment. And then we allow them to fund the rest of it through payment programs. But sometimes that little bit of grant funding or donation money is enough to help those people feel like they can get started, you know, that they're just receiving that little bit of extra support. So we're combining both in our practice frequently.
And then what was the question? What was the stat that you mentioned, Dr. P, on people on assistance? There was a question about that.
Yes, I'm just typing it in the chat.
Awesome.
It's from the Access to Care Coalition report from 2018. 29 million pet owners are on government assistance. And you can get a lot of great information. And remember, that was in 2018. So the numbers are probably worse now, right? So it's bad enough, the numbers that you see in there. 60% of Americans are living paycheck to paycheck of all working Americans.
Mm.
So.
And then there was also someone that asked about documents that you have for pricing and that sort of thing. When we follow up in this webinar, we will make sure to include links that we have shared in the chat, any documents or anything like that the team with Open Door has that we can share. We'll make sure to include links to those things as well. And then go ahead.
I was just I'm putting the, if there's questions that people want to, have a consult or find out more, I put the link in the chat again, opendoorconsults.org.
Yeah, that's really great. And so, and that is a big part of this, right? For everyone that is joining us. We want you all to talk to Open Door. This is definitely right in line with what we're doing with the Haas model. It's thinking about things totally differently, really trying to be innovative. When you were talking, Mandy, about having specialty funds, there are many shelters that we are seeing more and more that are coming out with specialty funds that then work with a local veterinary practice that is willing to be flexible in taking some of that money that they're getting from shelters to partner with a payment plan or something like that.
Right.
That shelter's still getting the same amount of, or that veterinary clinic is still getting the same amount of funds. It's just not really worrying about where it's coming from. And that is the important thing. Really, that's the thing that I think is the most unique about this model, is that people are really starting to say, do we have to do things the way that we've always done them? Or is there truly a way that we can be thinking about what we do in a different way to be able to better serve the pets and the people in our community, to see less struggle, and all doing our part for that. So another question in here, what type of equipment did the clinic start off with? What equipment's necessary for you to get pricing, that sort of thing? So just kind of the parameters, maybe some of the parameters on what it's like to be an Open Door clinic.
So I can tell you what Amy says. They did purchase the Toledo building, and she said she wouldn't do a purchase again. She would definitely recommend a lease. And the retrofitting then is just the only cost that you need. And there are digital x-rays at both, obviously, in-house blood work. And so all the basics in the clinic. So I don't have a number. I don't know if Dr. Quinn, you remember the number for the upfront, if you had to start and do all the equipment. I don't have that number off the top of my head. I'm sorry.
I don't. We do also have ultrasound. So we are slowly adding a little bit more to our clinic as we are continuing our profits. So we have like a wish list, and my big thing was an ultrasound. So I got my ultrasound. So we do have a lot of toys that we are able to still purchase to stay in line with the quality of medicine, and be able to offer those things for a little bit cheaper of a cost to owners. In our area specifically, we have one board certified ultrasonographer who works mostly from home. He works 1 day a week in an actual brick and mortar. So being able to provide ultrasounds to our clients has really been helpful. So definitely have the potential to have toys.
Yes. And also, like in Asheville, if you have an x-ray, I mean, you can send it to the cardiologist and get a stat response super quick. So, so really it's to me a regular private practice. We are Monday through Friday right now. So we don't do emergency overnights or weekends right now at our 2 hospitals.
Yeah, and neither do I.
Yeah,
No critical care cases. We're not doing any critical care.
yeah. But I know Dr. Quinn sure does a lot of stuff with the clients, or has them, in the hospital during the day. And then they, I've sent clients home, pets home with catheters and some flushes and come back in the morning, you do what you can, right? You do what you can.
Amy just texted me in, and it was 250,000 for the equipment list.
Okay.
And I think she said she'll provide that. But yes, I love my critical patients, so I probably see more than I probably maybe should. But I also have a lot of hospitalized patients that come through, so we do have pumps and things that we can keep track of and provide quality care to our patients, despite not being a full-fledged emergency clinic.
And there is a few more questions here about payment, about compensation for staff and that sort of thing. So if you could touch a little bit about some of the ways that you navigate that through Open Door.
So the veterinarians everybody's paid salary. It's not based on compensation like in a traditional practice. And we definitely try to have competitive salaries, of course, because it's so difficult. And I'm sure everybody feels and knows there was a recent article, I think it was the Humane Society of the United States, that for every 18 veterinary openings, there's one veterinarian looking. And for every 8 or 10 veterinary technician positions, there's one tech looking. So you really have to be paying competitively. And that's again why it's so important to net profit. So because we all deserve to make a decent living wage, right? So this model allows for all of these things to happen.
Do you think it's easier, Sarah, or harder to find veterinarians with this model?
That's such a good question. So, I mean, that remains to be seen, right? Because we're right now with 40 potentials, right? We don't know yet. And I definitely think those animal welfare, shelter kind of minded veterinarians are very much drawn to this practice, type of practice. If you want to be a specialist and do orthopedics, you're not going to want to be in this practice. Or maybe you want a 24-hour, but like now emergency clinics and 24-hour care are so much more rare, I think. So I think some people will want to do it and some people won't want to do it. I am a little nervous about veterinary schools really just teaching like the Cadillac stuff and not teaching incremental care. That's a little scary because most of America can't afford it, So I think that we're trying to educate vet students as well around this model. Suck them in while they're young.
Well, and to speak to that, I interviewed, because I am trying to staff, I interviewed 3 graduating veterinary students this year, and all 3 were very interested in incremental care. I think that the pendulum is swinging back the other way.
Wow, that's great, Mandy.
I think for a while, veterinarians were afraid legally to offer anything other than Plan A, that they really felt compelled that they were not practicing properly, and that would be held legally liable if they offered any incremental care. And I think now with these new veterinarians that are coming out, I think that that's changing. I think that the attitude is changing. I think that the practicality is coming back. The art of vet med, where it's not cookie cutter. There's an art to exploring what is needed by a client and a patient. It's not one size fits all, so I think that the veterinarians that I'm speaking to now are very interested in this line of care, and they also are not competitive. The competition of ProSal is not attractive to a lot of these veterinarians. They want to work as a team with other veterinarians and staff members, not playing the game of who gets the best client that day, so.
Well, I hate to cut you off, Mandy, but we're at 6 o'clock. This is incredible. I think we could keep going for probably
Yes.
another 30 minutes to an hour. It's obviously a topic people want to hear a lot more about, have a lot more questions. Thank you all so much for doing this. Thanks to Maddie's for helping to sponsor a lot of this work that's being done. We couldn't do it without them. And thank you all of you for being so innovative, such innovative leaders in this space. I am mesmerized by the work you do. I love vet work, and I think y'all are doing incredible things. So thank you all for your hard work. And thank you everyone for joining us. The recording for this will be available in the next few days, so you'll get a link to it.
And
Thank you.
thanks to Haas.
Great.
Thank you.
Thank
Bye.
you.